Hi everybody, I'm Dr. Roger Tsai and I'm a board certified plastic surgeon here in Beverly Hills, California. Today we're going to talk everything eyelids, upper eyelids, lower eyelids, rejuvenation with non-invasive procedures as well as surgical procedures. We'll go over what patients want and desire, whether it's just for rejuvenation or for a trendy look, over their surgical procedure, as well as the recovery, expectations, and results. So let's get started. When it comes to facial rejuvenation, the one area that creates a significant change and very effective change is the eye area. The reason is as we age or we get tired, the eyes are the first area that people look at. So if we can rejuvenate and fix that, we look younger, we look more refreshed, more energetic, and more awake. So let's break it down. There's the upper eyelids and the lower eyelids. So let's talk about the lower eyelids first because I think that's what ages people the most. So there's two issues with the lower eyelids. The first is the bag area that a lot of patients have and the tear trough area that oftentimes is sunken. So with the lower eyelids, there's actually two ways of fixing this, a non-surgical and a surgical option. If you're a good candidate, a non-surgical option is to place filler in the tear trough area where there's a divot, and that will help smooth out the entire area. Now, that will not get rid of the problem. That will not get rid of the bags that are in that area, but at least it will soften and smooth it out without surgery and maybe bandage the problem until you're ready for surgery. Now, the way to fix this permanently is to remove the fat pads in the lower eyelids. So we have 3 fat pads on each eye in the lower eyelids, and all 3 are taken out during what we call a lower blepharoplasty. So the way that I perform these procedures is called a transconjunctival approach or a scarless approach. There's no external scars. So the eyelid is flipped inside out, and that red portion called the conjunctiva is incised, and that's where we go in and we take the 3 fat pads out in order to create a smoother surface. Because of the approach, no stitches are needed and there's no foreign body or material that is left in place. Oftentimes, the tear trough continues to have an indentation there, and the way we smooth that out is to do what we call fat grafting. So we take a little bit of fat from your belly, just a very small amount, and we inject it into that tear trough area in order to elevate the depressed region. Oftentimes, patients have a depression in the lateral portion of the eye here, so with the fat grafting, you can smooth out this entire portion, including the upper part of the cheek. So a combination of taking out the fat pad surgically and the fat grafting here as well will oftentimes create a much rejuvenated and youthful appearance to the lower eyelid. So let's talk about the upper eyelids. Patients come in saying they can't open their eyes or their brows feel very heavy. So there's 2 things we have to break down. Is it a low brow or is it a heavy eyelid? Because those 2 things are totally different procedures and are treated differently. One way to analyze this is to feel that forehead bone. Your eyebrow should be at or above where that forehead bone ridge is. If it's below that forehead bone ridge, then the brows are too low. If it's at or above, then it's in the right position. So if the brow is below that ridge, then patients need what we call a brow lift. So what that does, it pulls the eyebrows up, and along with pulling up the eyebrows, it also opens up the eyes at the same time. Now, it's important to differentiate this because if you do an upper eyelid lift and then you realize that the brow is low, if you want to do a brow lift in the future to elevate it, you will probably most likely not be able to, because by doing that, your eyes won't be able to close. So during a consultation, your surgeon should be able to differentiate this for you. So if the issue is truly just a heavy upper eyelid, then the procedure here is surgical. There's unfortunately not a very good non-surgical procedure to help with this. But the surgical procedure is very easy and can actually even be done awake. The way I do it is called a pinch technique. So what we do is we pinch the excess of skin on the upper eyelids, we draw a wedge out, we numb it up, and we cut it out, and then close the intervening tissue. Although the incision here is on the outside, it's hidden in the crease that we all have in the upper eyelid. And the scars heal very, very well. Once it's healed, nobody will ever notice it. As far as the results go, what it does is it actually opens up your eyes so that you look more awake, youthful, and refreshed. Oftentimes, patients need a quad bleph, which is the upper eyelids and the lower eyelids, so all 4. This procedure will significantly improve the facial youthfulness and rejuvenation to the face. Last thing I want to talk about is a fox eye procedure, because that is somewhat similar to an upper eyelid lift / brow lift. I made a whole new video about this, so please click on the link and you can kind of review that video and get more information. As far as recovery is concerned, eyelid procedures are the easiest to recover from. Most patients don't even need any pain medicine. Ibuprofen, Tylenol, and you're probably good to go. When it comes to the lower eyelids, as mentioned, there's no external scars or cuts, so there's no stitches. When it comes to the upper eyelids, there is a permanent stitch that I place for 1 week, but it's hidden again in the crease. The permanent stitch will be removed at your 1 week appointment. Patients are back to their normal daily routine and activities the next day. You might have some bruising and swelling, but that is well controlled with ice and arnica. By the 1 week appointments, after you see me, you should be back to everything you're doing in life. So this is a brief overview of everything eyelids. Obviously, this is a customized procedure for every single patient, which is why a consultation is important, just to review each patient's specific goals and concerns, and then we can also review the surgical technique with you as well. I hope this video was educational and informative. Comment below and tell me what you think. If you have any questions or would like to book a consultation, please reach out to our office and I'd be happy to take care of you.